Welcome, everyone. My name is Dr. Liana Lianov, and I'm the president of the Global Positive Health Institute. And this is part of our learning series, podcast and YouTube series on all things positive psychology, health, and healthcare. And today I'm delighted to have with us Dr. Ted Barnett. He's what they call an interventional radiologist. He's really passionate about eating a plant-based diet. He likes to call himself Dr. Veggie, or the high-tech doc with the low-tech solutions, and happens to be the founding president of the Rochester Lifestyle Medicine Institute. And so welcome. Ted, how are you?
I'm great, Liana. Thanks for having me. How are you today?
All right. I'm excited to chat a little bit about your perspective from a perspective of lifestyle medicine and how important positive psychology is to lifestyle medicine. And we'll start off with what first grabbed your attention about this positive psychology area and how it's important to all of us in our well-being.
So really interesting. I know you sent me that question and I thought about it and I realized, back in medical school, I didn't know the term positive psychology, but medicine seemed, and I'm a third generation physician. So I've known a lot of doctors, and I had this realization that actually medicine might be just another form of entertainment. Now, before you jump on me, let me explain that. Really the purpose of medicine is to bring joy into people's lives. It's to allow for them to be fully, realize their lives and to be joyful. And, sometimes doing a procedure on someone makes their artery better, but it doesn't make them happy. Or putting somebody on medication may make their numbers better, but it's not going to make them happy or feel better. And I started to compare. I was living in Boston at the time when I was in medical school, and I was going to a lot of shows, dance shows, comedy shows, concerts. And I was thinking, well, these make me really happy. Maybe medicine's just another form of entertainment. And actually medicine's not doing as well as these other things. They're going to a sporting event. You want to be happy. These are the things that we need to do. So how can we make sure that at least we're making people better off with our pills and procedures than they were before they came to us? So I started to think about that a lot. And I've been challenged by that ever since. Yeah.
Well, I love that because I resonate with that. I've always been interested in not only what makes people tick, but what makes people happy. And at some level, as a physician, I knew that that's got to be so important to our health. And yet in medical school, we don't really certainly traditionally talk about that. And so that's why we started Global Positive Health Institute, to turn things around and let our colleagues know about its importance. So with that, share with us a little bit about how you apply positive psychology and these happiness activities in your personal life and professionally.
Sure. So, I guess I take a little bit of a utilitarian philosophy approach to this. Is what I'd like, everything you do should make things a little better, right? As physicians, we always cause harm. We can't help that, but we hope that we're causing more good than harm, right? And for me, since we're talking about happiness and joy as the prime mover for me in medicine, it doesn't matter whether it's a patient or somebody I work with. So, the technologists, the nurses, the other doctors, I like to think that, any encounter I have with them is going to make them happy. And so, my approach to that, I use music some, not so much anymore, but when I was a medical student, I play the recorder. It's a, medieval wooden instrument. And, I used to go around the hospital playing for patients, and this is decades ago. Now I don't play so much for people anymore, although I do around the holidays. But I think humor is very helpful, and I like to. Well, let's talk about how I deal with patients, because I do a lot of procedures. Now I used to do a lot of sort of more dangerous procedures, but now I'm older, so I do mostly breast imaging, and I do a lot of breast biopsies. So I'm doing biopsies every day, a lot of eye-hand coordination with ultrasound. And the patients are obviously very nervous. So, the first thing we have to do is there's always a timeout. Got to make sure you have the right patient. So people can share this little technique if they want. I ask them to spell their last name, give me their date of birth, and then I ask for their favorite color. So what's your favorite color? And they'll say blue. And I say, yeah, it says blue right here. You're right. We got the right person. Right. Or if they hesitate, I'll say, oh, I don't know if we have the right, anyway. Right. And then I always ask, what kind of work do you do? Because I think that's really important to make that connection. And I'm truly interested. I don't do it just because I think it's, what I should be doing. I really do want to know what people do for a living. And you have to phrase it carefully because, first I used to ask, well, what's your job? And I would get a lot of women who would say, oh, I'm just a housewife. Right. And I would say, that's not good. Right. So, I rephrased it. So, now I can't remember how I phrase it when I walk in. So what do you do for a living? I guess is basically, right. Yeah. I take care of my kids or my grandchildren. That's great. And I want to hear about, or, I'm a psychologist or, a college professor. And all of a sudden, and I'm old enough now that I can pretty much communicate back with no matter what they say, because I've met so many different people now, right? And I love to meet lots of different kinds of people. So that's to me how I deal with patients, with the techs and the clerks and everybody. I just like to make that personal connection. So when I walk into the office in the morning, I make a big circle. I go to every little section and say hello, good morning. And they say, oh, Dr. Barnett, it's so good to see you. And there's usually 2 radiologists in the office where I work. And so just try to make people a little happier that way. That way, if I don't make, if I don't make anybody happy for the rest of the day, at least I've done that. So,
And as you're speaking, I can tell that is not only fun for the patients, for you. So you're hopefully have more of a spring in your step for the rest of the day. But I think sounds like it's quite meaningful as well, that's much more meaningful than whatever procedure that you're doing. And so we know having meaning in our lives is so important to our overall well-being. And so through this revised attention as you go throughout your day, working with patients, you're adding that meaning and you're adding years to your life. So that's terrific. Good for you.
Yeah. Oh, thank you. Thank you. Yeah, and some of that actually, I think most people want to do that, but they need permission. They think that that medicine is all really serious and we can't behave that way, right? We can't burst into song, we can't tell jokes. We're just here, it's all business. And I think once people realize that it's okay, in fact, we encourage it, they feel liberated and they do it themselves.
Yeah, so you're speaking also to, in the positive psychology world, we say there's hedonic positive emotions and eudaimonic positive emotions, and the hedonic are the fun things, just pure fun, and they have a role, and then the eudaimonic are the positive emotions from doing something meaningful, and those are also important. In fact, they're probably a little more closely related to overall physical health and longevity, but we need both. We need fun and meaning, and all the positivity and emotions that will propel us forward for our health and well-being throughout our lives. So do you have any favorite things that you do for yourself?
So
outside of work?
Yeah, I have a lot of hobbies. I mean, the most important thing for me to stay in a good mood is to go for a run. I'm addicted to exercise in a good way. I love getting outdoors and running. The courses that we teach, my wife and I have been teaching plant-based nutrition to the general public since about 2011. I have this phrase I use, which is eat more fruits and vegetables and go outside and run around. So I really think it's important to be outdoors. So I need to run to kind of reach my baseline. And other exercise does work for me. I mean, in terms of if it's exercise that doesn't get me out of breath, it doesn't work. So bicycling doesn't work unless I stand up on the pedals and go as fast as I can, which actually is actually not a bad way to do. I injured my back last summer, so I couldn't really run, but I was able to bicycle. So the only way I could really get that same high out of biking was to stand up on the pedals and go as fast as I can. I don't use a road bike because I think they're dangerous, but I just have a regular upright bike, which is great because it's less efficient, right? So you get more exercise. And where was I going with that? So anyway, it's got to be kind of exercise that gets my heart rate up and me out of breath.
Yeah, so what you're speaking to is that physical activity and actually many other healthy or basic healthy lifestyles types of approaches and elements, including plant-based diet and getting high quality, adequate sleep, they really boost our emotions and boost the positive emotions. And most people know that it's a huge part of what we offer in lifestyle medicine, is that we're boosting not only physical health, but mental and emotional health. But I also want to add that it goes the other way too. So for people go, okay, I'm not that physically active. What's lovely is through positive activities that boost positive emotions, you're more likely to do physical activity, and then around and around it goes. It's that reinforcing reciprocal relationship, and happens with every aspect. Also, again, with plant-based diet, with sleep. That's just a key part of wherever you are in the cycle. Start where you are and keep, and it will be an upward spiral towards your total well-being. So I appreciate that.
Yeah.
And do you have any other tips? We've got a broad audience, but it's mostly a health professional audience. If they're really gung-ho to make the most out of this powerful science of positive psychology, any other tips? You shared a few already in terms of how to incorporate it into practice, not only with patients, maybe in nudging what patients do, possibly even prescribing these kinds of activities. What are your thoughts on that?
Wow. That's a really broad question, because lifestyle medicine is really about your entire life, right? And whether you prescribe, well, for me, music is the other one, as we all get really, really busy. So maybe this is more about people's personal lives. Talk about taking care of patients in a minute, but in your personal life, we get so busy that things fall off that you can't do, right? Some days I can't even have time for exercise. So those are the days when I'm in the building where I work, well, I'll run up and down the stairs, and I have my alarm goes off on my watch. It says time to go run the stairs. And, and that helps a lot. Music often falls off. So I play the saxophone also, and I like to play jazz. And, I confess I haven't practiced now in a month, although there are, in the last few months, I've probably practiced every day in certain,
well, so next time we have you back on the podcast, you're going to bring your saxophone, and
sure.
we'll keep you accountable for practicing.
Right. But in terms of dealing with, patients, this is all about behavior, right? And eating the right food. We all, most people know that when they're not eating the right food and when they should be. And so, we obviously advocate a plant-based diet. Our family's, we've been vegan since 1991 when we read the work of Dr. Dean Ornish. And, at the time I was interested because for environmental reasons. And so I said to my wife, well, we can, and she was interested for the animals. And I said, well, we can make the switch, but we're going to go, first of all, I got to make sure it's not dangerous. Okay. And I set the bar really low. I just said it only has to be as good as the diet we're already eating, which was, very close to a standard American diet. But then I started reading about it, I realized, oh my God, not only is it as good, it's way better and way healthier. And then I came across Ornish and I said, Carol, we're going to do it, but if we're going to do this, we're going to go the whole way. So we did. But most people know that they should be eating a better diet. They just have a hard time doing it. Most people know they should be getting more sleep. Right? That's, it's one of the pillars of lifestyle medicine. It's not rocket surgery, right?
Yes.
Right. So, but they need to focus on that, and people know they need to handle their stress better. So we've run, one of the ways we got started working with the public. Well, my wife and I run the Rochester Area Vegan Society. We've been doing that since 1995. So we're used to answering questions about these things, and then we decided we would give a course to the public. So back in 2012, we went to the local JCC and said, we have this 6-week course. It's 12 hours. It's going to meet 2 hours a week for 6 weeks. And we'd like to teach that. And they said, great. A couple of years later, we got it accredited through the Rochester Academy of Medicine. So for CMEs, and we started teaching that to doctors, and a lot of, patients showed up as well. And then, if you're looking for something in your armamentarium, as a clinician, there's the CHIP program, which is sort of the granddaddy of lifestyle medicine group programs. And when we started Rochester Lifestyle Medicine Institute back in 2015, that's why we started it, was to run CHIP programs. And CHIP is wonderful. It's still great. In fact, it's ACLM accredited. And then the LIFT program came along, and that's ACLM accredited, and we teach that. And back in 2017, we started working on our own project, the 15-day whole food plant-based jumpstart, and that's now ACLM accredited. So we're really excited and proud about that. So these are tools that you can use, that you can do either. It's, I think, best in a group setting. One thing about lifestyle medicine, as so many of us have learned, is that the shared medical appointment is really critical for many, many practices. Not for all practices, but for some practices it really works. And so it's nice to have the CHIP program, and you can do LIFT as a shared medical appointment. You can do our Jumpstart as a shared medical appointment. Those are some of the tools. I don't know what else.
That's great. And just I want to jump in for the people in our audience who are not familiar specifically with the LIFT project, which is about lifting emotions and the whole cadre of actual physical lifestyle behaviors, as well as some of these positive psychology types of interventions, that it's a beautiful program that can, in essence, be prescribed or used in teams. So tell us a little bit, you're using that and your team is using it. How are you using that?
So the LIFT project it's really amazing. It's based on positive psychology, and Darren Morton is a star. He, no doubt about it. He's actually in the one of the major actors in the CHIP program. So and he's I'm told that he's very good looking. At least that's what all my female participants tell me. And so when we started running CHIP back in 2015, I'd show up once a week, and the patients would say, "Is Darren going to be there today? Is he on the video today?" So yeah, Darren. Anyway, so he came up and he talks about positive psychology in the CHIP program. He talks about PERMA, and he rearranges the letters to be PERM, which I can't remember the letters, but you probably do. Anyway,
PERMA, positive emotions, PE, engagement or flow activities, R for relationships, social connections, M for meaningful activities, and A for accomplishment or accomplishing meaningful goals. Yes,
exactly. He likes to put meaning at the end, so he puts accomplishment before that. And he went on, and he's an Australian. He's got a great charming accent, and he's obviously very athletic himself. He's you learn about that when you go through the LIFT project. He goes hang gliding and he likes to run, but he put together these basically 10 sessions that you're supposed to do like once a week. You're supposed to space them out, and you can do it on your own. You can sign up at the LIFT project .global and just do it on your own, and I think it's $99. Which is an incredible bargain for what he's put together. And then you go through their whole learning management system. You can watch his videos, and there's reading materials, and there's also audio podcasts, which I've listened to. And then there's homework, and some of the homework will be, commit a random act of kindness every day this week, something like that. I don't remember all the homework, but and then so the different sessions are, help me out here. If Kim Taylor, my facilitator, were here, she could list them. But there's one on plant-based diet. The rest are on like gratitude and exercise, and motion creates emotion. Darren likes to come up with these phrases. So blue and green should often be seen, which is a variation.
Time in nature. Yes.
Right, time in nature. Yes. Exactly.
We'll do another podcast episode where we'll go into more details about the LIFT project, but that way now our audience knows that this is something that you're incorporating and using
absolutely
on a regular basis.
Yeah, and it's really interesting because our Jumpstart, a 15-day Jumpstart, we ask people to make a huge change in their diet all at once for 15 days. And a lot of people love to do that, and it's great. But if you're depressed and miserable, you can't do that. So going through something like the LIFT project first, I think, is really fantastic.
Yeah, absolutely. And for clinicians in the audience, particularly physicians or others who are thinking, well, I'm very busy. I squeeze so much into my time with my patients. I can talk to them a little bit about this important element of well-being, but probably can't do that much more. So then being able to refer them to resources like the LIFT project, and there are other resources, those can even be prescribed, is a way to help your patients help themselves with this key component of well-being.
Right.
Yeah, terrific. And as we close out this session, any other thoughts of wisdom around well-being and how it links with healthy lifestyles, positive emotions, having fun, meaning, all that good stuff?
Yeah, so that's really interesting. I think we're at a time in history where kind of in a worldwide depression emotionally. And if people think too hard about what's actually going on, it can be really very depressing. And, I always go back to one of my favorite quotes from my favorite farmer poet, who is, oh my goodness, what's his name? Anyway, he said, it'll come to me after I give you the quote, I think. Okay, it's be joyful, though you have considered the facts. And that's Wendell Berry. I don't know if you've heard that before.
No, I haven't. That's
Yeah,
lovely.
be joyful, though you have considered all the facts. That's Wendell Berry. He's just a phenomenal guy. Great, lots of good quotes like that. And, we can't become paralyzed. So our job is to help people stay positive, through positive psychology, and be able to do the work that needs to be done, and realize that we can't solve everything on our own, but we can be part of the solution.
Terrific. Great way to end, which is to be part of the solution. That's a positive way to end. Well, thank you so much for joining us today. Maybe we'll bring you back some other time and learn more, especially as I know there are changes, for example, in the LIFT project and other things that we're doing with the Global Positive Health Institute that may affect things that practitioners such as yourself are doing on a daily basis and doing such good work. So thank you for your good work. And it has a ripple effects, because you're one of our lifestyle medicine leaders that's leading the way for other health practitioners that we've been talking a lot about lifestyle medicine that are maybe not as familiar with lifestyle medicine. And that's one of the things we'd like to accomplish through this podcast, is expose others to these ideas. So thank you again. And thank you to our listeners for joining this podcast videocast series. And please like us, subscribe to our channel, and we'll see you again sometime soon. This is the Global Positive Health Institute. Be safe and be well. Take care, everybody. Bye-bye.
Thank you, Liana. This was wonderful. Bye-bye.